Clarify registry is important because it's the most contemporary registry of stable coronary artery disease, what we now call chronic coronary syndrome patients. It involved almost 33,000 patients from 45 countries, which is quite impressive. And the results showed a mortality rate of around 1.7% per year. I think it's a very important survey, first of all, because it's so big. Second of all, because it encompasses 45 countries throughout the world, and because it's quite contemporary. I would say the major caveats regarding this registry are, first of all, that although it's the most contemporary, these patients were enrolled over a decade ago, and the results are true to 3 years ago in 2016. Also, we have to remember that the results are not adjudicated by a committee, but it's self-reporting by the physicians who enrolled the patients. So we have to analyze the results with a grain of salt regarding events such as cardiovascular death. However, it's, as I said before, the most contemporary database that we have of chronic coronary syndrome patients. One of the intriguing findings was the relationship between angina and prior MI patients. In this study, they showed that patients who had angina, who did not have prior MI, had a very low mortality rate, whereas patients who had a prior MI, who had angina, had a very high mortality rate. This has to be analyzed in other registries and studies, but maybe the investigators have identified a very unique subgroup that entails a high mortality rate, which deserves special attention and maybe special treatment. Thank you.